So chairs and people having difficulty getting in and out of their chair. The important thing is that you actually see the person actually sitting in their chair and actually how they get up out of the chair. It could be that the person has lost the ability or forgotten, because they've been in hospital for such a long time, how to get out of their chair. So you may need, and in your pack there's a refresher about how actually somebody should be getting out of a chair. And that is moving forward to the edge of the chair, making sure your hands are on the chair, you put your nose over your toes, you separate out your legs and you push down and up. If somebody's got a Zimmer frame, they would then have the frame and off they go. Sitting back again is the same. They come back, the back of their legs need to touch the back of the chair. They put their hands off the Zimmer frame onto the chair. It could be they want to actually move their leg forward and then sit down. Sometimes the chair itself is worn and it's too low, so it needs to be raised. But we normally want to use the client's own chair. A chair is an old friend. Right? Somebody who's 90 and has had the chair for 20 years does not want to get rid of that chair. The standard stock that we would do, and that's normally for somebody with short-term conditions, is something called a Seville chair. And this is a height adjustable, firm high back chair. You can adjust the height, you can adjust the depth, you can adjust the height of the back as well. But normally what we would do is, in preference, raise the client's chair, and you'd normally raise it from the bottom up. The reason that I say that is because you need this depth here to allow pressure, to allow momentum really for the client to actually get up. Now there's various ways of raising a chair, and in Croydon our technical officers will normally decide on what they want to use. But you've got something called Langhams. These are Langham chair raisers. They go underneath the chair and the legs fit in there, and they can raise the chair by 75 millimetres to about 100 millimetres. There's also some other hexagonal blocks that you can use as well, and these come in 25 millimetre sections, so you can raise them an inch at a time. What you have to be aware of, and although the air technical officers will raise the chair, you still have to be aware of the equipment, because sometimes what happens, as you see with these, is that there's an added piece added to the leg. So if I put this onto here, there's an extra piece there that if somebody's got visual impairment, memory's not so good, they might not realise, and I have known people trip on this. Also, sometimes what people are concerned about is that if you put things on the chair, they won't be able to move the chair to hoover. The fact that they possibly haven't hoovered for a number of years is besides the point. They are very concerned. So you do need to take that into consideration when you're thinking about raising a chair. To measure for a client's leg length, first of all, obviously, you've seen the technique that the client has used to get out of the chair. You've looked at the chair to make sure that it is of a decent sort of structure. Sometimes the banding underneath the chair has gone and they need to get it repaired. The service itself does not provide furniture. They're not furniture providers. So if somebody's got a chair that is broken, they need to provide their own chair, and then we will raise it. If they want advice about chairs and where to get them, then we can provide that. Somebody who's on income support or can actually get a community care grant from the social fund to enable them to purchase a chair if need be. So sometimes, as again, we're not We provide a service with a conscience, and sometimes if really the client hasn't got anything to sit on, if you speak to the intake team, we may well be able to help. But as a rule, if somebody didn't have a bed, we don't provide them with a bed. So that's the rule really, is that they are responsible for their own furniture. So if we can just measure for a leg length, Ali likes to come back now, I'll show you. So obviously you're using observation, and also you're asking the person to do the activity. If the person can't, for instance, get out of the chair, and they've not got out of the chair for a year, you don't want to get them out of the chair because they obviously can't. But if somebody's getting out of their chair, going off to bed, doing the normal activities, it's reasonable to ask them to get up and walk for you. And that's what I would normally do when doing a chair assessment. I would also look to see whether or not, and maybe we just need to move the chair sideways a little bit. If we could just get up a minute. That's it. There we go. We move the chair that way. What I'm looking for as well is that we're looking at a 90-degree angle here from the hip down to see whether or not the chair needs to be raised. If I wanted to see what the chair height was and also the leg height, I would normally expect somebody to be sitting in the chair so it's compressed. And I would usually measure from the floor to the top of the chair. So that's a compressed height, and we're talking of about what, 430 millimetres, 430 millimetres, or you're talking about 17 inches. If I'm wanting to measure the client's leg length, I'm looking at the popliteal fossa, which comes round here and to this crease here. And here you're looking at something like 470 millimetres, or about 18.5 inches. Now, depending on what the client is saying is the problem, it's whether or not I would raise that chair. For this particular person, if they haven't got a problem, they're managing, I would say that that's roughly okay. But sometimes you might need to raise the chair 75 millimetres, 3 inches, to enable somebody to get out of it safely. So as we've said before, you obviously need to get consent to being close to the person, and their normal footwear is important. So for instance, if they normally wear heels, it is appropriate to measure with the footwear on. You also need to consider that I'm talking about people with long-term conditions. So I'm talking about somebody that possibly stays a long time in their chair for many hours. And normally I would not raise a chair higher than their leg length. You're talking about short-term conditions, like somebody that's had a spinal operation or somebody that's had a total hip replacement. That's slightly different, and you would raise something higher because there's a health need there. I'm talking about somebody that perhaps will, if they've got edematous legs, ulcerated legs, and you're going to then put pressure on their thigh, you might well cause problems in relation to the fact that additional problems in relation to the edema. So as a general rule, you need to make sure that the person's feet are on the floor and that generally their hip and their knee are at 90 degrees. And for long-term conditions, I would not raise the chair any higher than their leg length. If you have any problems with that, obviously the intake team will be able to advise you.